Well, this is Mark Garber, and I'd like to give a little hip replacement recovery report. This is my second hip replacement. I got a hip replacement in 2008. That one seemed to work out pretty good, and my last hip replacement was July 9th here, and it was kind of during this COVID pandemic. I was kind of fortunate that I was still able to get the surgery at this time. I'd like to express my appreciation to the people at Rocksteady Ballroom who sent me this nice card. I'm not, I like most animals, but I wouldn't necessarily consider myself a cat person. And there's quite a few names in here. A few of them I don't recognize, and some of them need to work on their penmanship. But, it's a nice card, and I appreciate the thought. Even if I don't know you, I appreciate the thoughts. What I'll do is contrast some of the differences. Before I do that, I also got this appreciation card from the people at the St. Joseph Surgery Center. Byron Rosenstein was the guy that replaced both my left hip, and he replaced the newest one too. And the leg length seemed to be pretty even, so he obviously got that right, and I do appreciate that. I also got a statement of charges from the surgical center. It looks like the way they do it now as opposed to the way they did it 12 years ago, it looks like they cut the costs in half. But, the cost is still pretty significant, but fortunately, Medicare and my supplemental insurance took care of all those costs. And, I can understand because of those why the people at the surgical center would send me a letter of appreciation. But I do appreciate it, and everybody did a good job, I think. And, I'm up and walking around after 3 weeks, which wasn't the case with my first hip. I was probably using a walker for like a month. Here I maybe used the walker maybe a week, maybe a little less, and a cane after that. But it seems like the recovery is a lot faster with these new procedures. What you're looking at right here is some of the equipment that's used in the recovery. These two items here were in this second, on my new hip, this new operation. This first item is a Venaflow Elite, I think it's made by General Electric. It says Aircast on the top. And what this is an air machine, which you have this air bladder here that you put, around your calf, and this goes on both legs, and you attach this pipe, and it blows air into the bladder and keeps blood flowing, I guess, through your lower body. The reason you have that is because you want to prevent clots. Clots are a really bad thing to have, but fortunately these have. It's a little cumbersome to get on, but on my first operation on my left hip, in order to prevent clots, they gave you a regimen of injections to take, and you'd have to grab your wherever you could find some fat on your body and stick a needle in yourself, which you didn't have to do that this time. This air machine is okay. Helps with preventing blood clots, and you really don't want to have a blood clot, especially as a senior citizen. This other item is actually an ice machine, and I didn't have that last time when I had, but you fill it with ice, and you take this bladder and put it around. There's also a little bit of water in here, and so the bladder goes around, and you fasten it. They have some Velcro where you can fasten it. Kind of goes around like that. And, you know, it's considerably colder than an ice pack. It actually works pretty good, and it, you know, if you fill it up, it'll actually hold a cold water for probably an hour or so, probably much longer than that. Now, these other items I used also on my first hip replacement. This guy is a sock shoe as opposed to I guess a shoehorn, kind of like that. You put the sock over it, and you know, after the operation, it's pretty hard to reach your feet. So you put this sock in there, and then you take the rope and then put it down to where your foot can reach it, and then pull your sock over it. And of course, they give you some, you know, you have to purchase some items. One of these grabbers, because you know, it's a little hard to reach things. And when you're taking your sock off, this is kind of a good thing to have. And this last item here is I used both for my first operation, my first hip replacement, and also my second one. And I don't know who manufactured it, but you know, I've designated it the 3M Pooper Elevation Platform. You know, the 3M designation I'll describe in a little bit, but you know, this is some of the equipment. Didn't have this or this on my first operation, but that was 12 years ago. These items I did. The recovery, it was a lot faster this time around than on my first operation. It seemed like I had to use a walker for at least, you know, at least a month and a half, maybe a little longer than that. But eventually, you know, my left hip started feeling like a regular hip after that. My right one's still not all the way there, but it's getting there. And what I'll do in a little later in this little podcast is, you know, I'll describe, you know, how some of these items are used, especially this item, which is the 3M Pooper Elevation Platform. Okay, I'm now in the deployment location for the 3M Pooper Elevation Platform. And the way you deploy this is that you put the toilet seat up, you place the platform right in the toilet bowl. Now, I know some of you are wondering what the 3M stands for, and I'm sure you've heard of 3M. They make a lot of really good products. I think 3M stands for Minnesota Mining and Manufacturing. Well, that has absolutely nothing to do with this. So you've deployed the platform. It's probably a good idea to flush the toilet prior to deployment. That way you don't get any unpleasant splashback. One of the great features of this item is that it increases your altitude over the target without adversely affecting your accuracy. Now, prior to getting your joint replaced, the surgeon sends you to joint replacement school, And they give you a list of items that you need to purchase. You know, pain meds, both prescription and off the shelf, are some of those items. And the pain meds do cause some constipation, and they suggest that you also purchase a laxative. That's really, the laxative is really another item that's on your shopping list prior to your operation. Sometimes the laxatives can work a little better than anticipated, and they probably should add, you know, a plentiful supply of this item as well. You know, that should be added to the shopping list, because sometimes the laxatives can work a little better than anticipated. So, you know, in the next video, I'll show you how this device is actually used. So just stick with me. Okay, I'm now perched atop the 3M Pooper elevation platform, and I do feel a little high. Of course, if you're taking some of the pain meds like Percocet, that feeling is probably enhanced somewhat. Now, you're probably wondering why the 3M designation. Well, typically at the time of deposit, there's probably a little bit of effort involved, and probably a vocalization kind of like this, where you kind of purse your lips together to make this sound like that, you know, that's kind of an M sound. Now there's probably maybe a little bit of, you know, other people might do it as an N sound, in which case it would be kind of like that, in which case you'd probably have to designate the apparatus as a 3M Pooper elevation platform. So, you know, once you're done, there is, and you're successful, and you've made a successful and adequate deposit, you know, there is a feeling of relief and kind of calm that comes over you. But, you know, that's, you know, part of getting a hip replacement. I'd like to thank everybody for watching this video. I hope that you found it informative and that it's supplied you with some helpful information if you're about to get a hip replacement. I would like to thank all the people that were involved in my hip replacement, both the first one and second one. In particular, Dr. Byron Rosenstein, who replaced my hip 12 years ago, the left one, and replaced this one this past July 9th. I'd like to thank Advanced Orthopedic Services. Those were the people involved in my rehabilitation. In particular, Mark Greenspan and Jackie Milpas. And I hope that you found this video helpful. And if you didn't, maybe you have an appreciation for pre-adolescent male bathroom humor with a senior citizen perspective. Please share it if you found that to be the case as well. Otherwise, don't bother sharing it. But I want to thank you for watching this video, and this is Mark Garber signing out.